I am Dr. Sunanda Chava. Today I would like to talk about endocrine system. So we have pituitary gland in the sella turcica in the skull. So this is influenced by the hormones released by hypothalamus. So the hypothalamus is connected to the pituitary gland by hypophyseal stalk. So the hypothalamus releases some hormones which induce the secretion of hormones by pituitary gland, and the pituitary gland will release some hormones under the influence of hypothalamus hormones and induce the other glands like thyroid gland and adrenal glands to produce the hormones. So this will increase the hormone levels in the blood. When they are increased above the normal or required level, they indicate the pituitary gland to stop releasing the hormones. So these adrenal or thyroid gland, then the pituitary gland will stop producing the hormones, and it will indicate the hypothalamus to stop producing the hormones. So the blood hormone levels are maintained. This is called positive and negative feedback mechanism. So the pituitary gland is the master gland. So this is controlled by hypothalamus. So there are some hormones released by hypothalamus hormone called releasing hormones. So the hypothalamus hormones are thyrotropin releasing hormone, gonadotropin releasing hormone, corticotropic releasing hormone, growth hormone, inhibitory hormone called somatostatin, and prolactin inhibitory hormone, that is dopamine. This thyrotropin releasing hormone stimulates the TSH by thyrotropes. Gonadotropin releasing hormone stimulates FSH and LH, that is luteinizing hormone and follicle stimulating hormone, by gonadotropes. Corticotropin releasing hormone, they influence the ACTH by corticotropes. And then growth hormone releasing hormones by somatotropes. Prolactin inhibitory hormone inhibits the secretion of prolactin by lactotropes. So coming for endocrine disorders, the pituitary gland is the master gland. So it is controlled by hypothalamus connected by pituitary stalk. Hypothalamus releases releasing factors which induce pituitary gland to secrete hormones. Pituitary gland has two parts. Anterior part are called, otherwise called adenohypophysis. It releases 6 hormones. And then posterior pituitary gland is called neurohypophysis. That is called neurohypophysis. It releases 2 hormones, antidiuretic hormone and relaxin. The anti-pituitary gland releases growth hormone, adrenocorticotropic hormone, TSH, FSH, that is thyroid stimulating hormone, follicle stimulating hormone, and then luteinizing hormone and prolactin. Coming for growth hormone promotes the growth of the entire body by affecting protein formation, cell multiplication, and cell differentiation. Adrenocorticotropin controls the secretion of some of adrenocortical hormones, which affects the metabolism of glucose, proteins, and fats. Thyroid stimulating hormone controls the rate of secretion of thyroxine and triiodothyronine by thyroid gland, and these hormones control the rate of most intracellular chemical reactions in the body. Prolactin hormone promotes the mammary gland development and milk production. 2 separate gonadotrophic hormones, that is follicle stimulating hormone and luteinizing hormones, they control the growth of ovaries and testes, and as well as the hormonal and reproductive activities. Growth hormone causes growth of almost all tissues of the body. It promotes the increase in size of the cell, increases the rate of mitosis. Therefore, increasing the number of cells causes cell differentiation of cells in bones and muscles. Growth hormone stimulates bone growth and causes delayed fusion of epiphyses with the shaft. It increases the rate of protein synthesis and decreases the catabolism. It decreases the use of glucose for energy. It increases the blood glucose concentration by decreasing the glucose reuptake by cells. It increases the insulin secretion. It also increases the fat mobilization from adipose tissue. Excess growth hormone has ketogenic effect. Growth hormone increases gastrointestinal absorption of calcium. It decreases sodium and potassium excretion, increases plasma phosphorus, and decreases blood urea nitrogen and amino acid levels. It is degraded in liver and kidney. Gigantism. Growth hormone excess causes gigantism in children and adolescents, and acromegaly in adults. That is, usually it's found in the age group of 30 to 50 years age group. Gigantism occurs before epiphyseal fusion, and acromegaly occurs after epiphyseal fusion. Epiphysis means growth plates. Gigantism, the sex hormones estrogen in females and testosterone in males and increase and cause growth plates to slowly fuse together. Excess growth hormone increases the muscle and bone and connective tissue growth, and they increase the height. The individuals will achieve approximately 7 to 8 feet in height. So it's caused by microadenomas that are 1 centimeter in diameter, macroadenomas that is more than 1 centimeter in diameter. Clinical features: tall stature, coarse facial features, prominent forehead and jaws, large hands and feet, fingers and feet thickening, excessive sweating, joint pain, carpal tunnel syndrome, soft tissue swelling, heart enlargement, obesity, diabetes, increased blood pressure, headaches, visual problems. Because this optic chiasma is very close to pituitary gland, it causes pressure on optic chiasma and causes visual problems, headache, and then pituitary gland damages other hormones. Pituitary gland hormones, other hormones are damaged if the other part of the tissue gland is affected. In rare condition, neurofibromatosis, McCune Albright syndrome, Carney complex, MEL type 1 can cause gigantism. So, the diagnosis is done by doing the GTT. So, after glucose drink, normally the growth hormone will decrease, but in gigantism, it doesn't decrease. So, clinical features, MRI and CT, clinical features you see, and then you diagnose, and MRI scan, CT scan can be done. Drug therapy like pegvisomant, somatostatin can be given. Surgery, radiotherapy can be tried as treatment. Acromegaly, it causes protruding lower jaw. It occurs in old age people. It might cause all these problems caused in gigantism. But here height doesn't occur because the epiphyseal plates would have fused. So the increase in height is not there, but the extremities get thickened. So carpal tunnel syndrome can also be caused. So in the extremities, thicken nose tip, cartilage, eye cartilage, chin, and then eyebrows, and then hands, tips of the fingers and tips of the legs can be, feet can be affected. So the hat size will not fit, the ring will not fit, and then denture won't fit, and shoes won't fit because of the increase in size. So then there might be menstrual irregularities, visual problems, headache, and then loss of interest in sex, and sometimes psychosis also might occur, headache also can occur. So it takes time for the acromegaly to develop over years. So today I have spoken about gigantism and acromegaly. I will meet you in the next video. Thank you. Bye.